Assalamu alaikum, everyone. I hope each of you is having a wonderful evening. I'm here to welcome you all to today's webcast on screen addiction. Owed to my background in psychology and my passion for exploring psychological, social, and scientific aspects of screen addiction, I'm very, very thrilled to be your moderator for today's discussion. Very, very important one. So let's introduce myself first. My name is Rania Rajput. I'm a psychologist by profession. I'm currently working at Women Empowerment Organization with Afghan refugees. And I'm the Chief Secretary for Youth Mental Health and Social Health at Pakistan Health Parliament. Well, today we are going to dive into this fascinating topic and explore what screen addiction is all about, what it is there a diagnosis for it, how do we manage it, and likewise. Because although we do understand and acknowledge that escalated screen time is an issue, but we don't really take it very seriously and give it much attention. So we don't really realize that too much screen time can be detrimental to your health. For instance, a great deal of researchers have found that those spending 6 hours or more per day watching screens have a higher risk of developing depression or are vulnerable to it. And so, limiting social media use for 30 minutes per day, for instance, lead to a significant improvement in well-being. So the type and quality of screen time also plays a very vital role in that. So yes, we'll be having a very, very detailed discussion about it today. But before that, I would be more than honored to welcome our speaker for today, Mr. Fazal Wahid, a graduate from King's College London, UK, and he's an addiction psychologist, he's CEO, Lifeline Private Limited, its leading drug addiction and psychiatric disorders treatment center. So all in all, you could say that he's a very cool guy. Now, I would really want Mr. Fazal to tell us a bit more about you and what work you're doing, and what are your interests and all. Over to you, sir.
Thank you very much, first of all, for the wonderful introduction. And the topic is really important. It is a contemporary issue. So let's start with the definition of addiction and the key signs and symptoms of screen addiction. So screen addiction, it is also referred to as digital or internet addiction, and it is a contemporary issue characterized by an individual compulsive use of digital devices to the point where it interferes with the daily life, work, and relationship. So it involves excessive engagement with digital devices, including smartphones, tablets, computers, and gaming systems, often resulting in significant distress or impairment in social occupation and their important areas of functioning. So it is similar to other behavioral, chemical, and non-chemical addictions where the behavior or substance triggers the brain's reward system, leading to repeated engagement despite adverse consequences. So this is how we define screen addiction. So let's move over to the key signs and symptoms of screen addiction. So the first sign of screen addiction is compulsive use. It's an overwhelming urge to use digital devices excessively, even when it's not necessary or detrimental to do so. For example, you must have noticed people with OCD that have a compulsive behavior, for example, hand washing. So even if that is not necessary and that is even detrimental, they also continue to do that. So this inability to control their own behavior is called compulsive use. So compulsive use is the first key sign or symptom of screen addiction. Then another symptom of screen addiction is withdrawal symptoms. Experiencing anxiety, depression, irritability, or restlessness when not using digital devices or when attempting to reduce the screen time. So that is the second symptom of screen addiction. Then comes tolerance. Tolerance means that needing to spend increasingly more time on screens to feel satisfied or entertained than before. तो ये एक कॉन्टिन्यूसली उसका जो टाइम है, स्क्रीन टाइम जो हम यूज करते हैं, वो बढ़ता जाता है टाइम के साथ, विच इज कॉल्ड टॉलरेंस, एंड इट इज द सेम इन other addictions like substance use disorder or other behavior addiction like gambling or food addiction. Then there's another symptom of screen addiction, which is called neglect to personal life, spending so much time on screens that personal relationship, work, or school responsibilities suffer. So the cost of screen addiction is basically the neglect of our personal life. Then another key symptom of screen addiction is deceptive behavior. I often tell people and families that addiction and honesty cannot exist in the same time, in the same place. So deceptive behavior is another symptom, lying to family members or friends about the amount of time spent on screens. Then another symptom of screen addiction is loss of interest. A loss of interest in other recreational activities, like showing a reduced interest in activities there, which were once enjoyable, in the favor of screen time. So if you look at people with screen addiction, you will find a loss of interest in those activities which they had been enjoying in the past, and in this favor of the screen time. And the last symptom, which is the loss of control, that continuing to spend excessive time on screens despite experiencing negative outcomes like poor sleep quality, physical discomfort, or strained relationships. So these are the key signs and symptoms of screen addiction. A study recently published in the Journal of Behavioral Addictions that explored the relationship between screen time and psychological well-being among adolescents. And it found that high screen time was associated with lower self-esteem and higher levels of anxiety and depression. Then there was another study or research in Computers in Human Behavior Journal, and they investigated the impact of screen addiction on sleep patterns, and discovering the excessive screen time, especially before bedtime, significantly disrupted sleep quality and duration.
That was very detailed, sir. Thank you so much for such a thorough, discussion on signs and symptoms of screen addiction. I would really want to know, first of all, I really want to make it very conversational, not like a strict interview format. Why don't you tell us a bit more about, some common misconceptions we have about screen addiction, and how does it differ from simple, simply spending a lot of time on screens?
Yeah.
Could you
Yes,
elaborate a bit more on that?
there are misconceptions, and these misconceptions are similar to the misconceptions in other addictions like substance use disorder and other behavioral addiction. And for example, the first misconception, which is very common, is that all high screen time is addictive, like you said. So spending, not all instances of high screen time qualify as addiction. The difference lies basically in the impact of on one's life and the presence of compulsive use patterns. For example, a person might use screens extensively for work, education, or creative pursuits without exhibiting the negative consequences associated with addiction, such as neglect of personal responsibilities, withdrawal symptoms, or the loss of control. So all high screen time is not, it does not qualify as addiction. It could be productive, functional, and non-addictive. It is if in the pursuit of some creative activities. Then another misconception is that probably screen addiction is only about the amount of time spent on the screen. So it's not just the amount of time spent on the screen. It involves more than just the quantity of the time. It's also about the quality of engagement and the psychological effects, especially. For example, if there is compulsive use, loss of control, and neglect of other aspects of your life, then it could be screen addiction. But if these symptoms are not there, so in spite of spending a lot of time on screen addiction, that cannot qualify for a screen addiction. So it is also another misconception. Then there's another misconception that screen addiction only affects teenagers and young adolescents, young adults. So that is also not true. While much of research on screen addiction focuses on younger population, but that is because of their high engagement with the digital media, not because of their age. So it is a condition that can affect individuals of all ages. The nature of addiction might vary, but with adults possibly experiencing different forms of digital addiction, such as compulsive email checking or excessive use of social media for personal or professional reasons. So age has nothing to do with it. It affects all people from all ages similarly. So these are some misconceptions. Then there's another misconception, screen addiction, that eliminating screen time is the best solution, which we also call cold turkey quitting. So that is also a misconception, because abruptly eliminating screen time is not a practical solution for most people, given the integral role of digital devices in modern life for communication, work, education. So instead of uh, cold turkey quitting, or instead of eliminating screen time altogether, strategies focus on moderation and mindful use of technology, promoting a balanced relationship with digital devices. So these are a few misconceptions that I think most people ask us about, or the difference between screen addiction and spending more time on the screen.
I totally agree with you, sir. That was again very detailed, and because we do, here in Pakistan, hear a lot about a lot of these misconceptions. We have a lot of these misconceptions. Even we can hear it around us in our families. And even in our immediate families, we often hear उर्दू में जिस तरह अभी हम कह रहे हैं कि मोबाइल की वजह से सब कुछ हुआ है. आप मोबाइल पे ज्यादा टाइम लगा रहे हैं तो उसकी वजह से नींद नहीं आ रही है. And we do hear a lot of these things, but as you mentioned it's not relevant to age. But could you tell us a bit more about, are there certain age groups that are more susceptible to screen addiction?
Yes, like all addictions, the most susceptible age group which is vulnerable to any form of addiction, including screen addiction, is the age between 14 and 25. And the reason for that is actually the brain is being developed. The completion of the complete structure or architecture or the basic design of the brain is complete the age of 25. So we may get our national ID card at the age of 18, and we may be called adults in the age of 18, but neurologically or in the neuroscience, we are adult when we are 25, because that is the time when our brain is, the structure of our brain is completed. So any teenagers until the age of 25, people between 15 and 25 or 14 and 25, this is the age group which is more susceptible to any form of addiction, especially screen addiction.
Thank you so much, sir, for clearing that misconception, and for getting in that in detail of how certain age limits, a certain age range are more vulnerable or susceptible to screen addiction. I would really want to know, how about we discuss the psychological and neurological mechanisms underlying screen addiction, as as you've said earlier that after the age of 25, or at the age of 25, you're recognized as adults neurologically. So how about we discuss a bit more about, what are those patterns, or what are those mechanisms that are underlying the screen addiction?
This is a very important question and a very important factor to understand basically the psychological and neurological mechanism underlying screen addiction. And they are very complex and multifaceted, involving a combination of cognitive, emotional, and neurological factors. And recent studies have also shed light on how these mechanisms contribute to the development and maintenance of screen addiction, like all addictions for that matter. So, but let's talk about it one by one, the psychological mechanisms and the neurological mechanisms. So first, let's talk about psychological mechanism.